Hello, today we're going to talk about bladder leakage in female runners. So, this is something super common that I see in patients that come see me in the clinic. And everyone always thinks I need to do more Kegels, right? Like, oh, my pelvic floor is weak, so I need to do more Kegels. That's why I have bladder leakage. And I would say sometimes that's true. But even if that's true, that's not the full picture. And right now is like the season for marathons and races. So I've seen a lot of female runners lately coming to me because after I run X amount of time, I have leakage. And so here's some of the things I see. So always I do, if they're comfortable with it, a pelvic floor exam. I rarely see like, oh, you just have weak pelvic floor muscles. More often I see, oh, you have tight pelvic floor muscles. So if we think about, let me show you this model of the bladder. The bladder is kind of like a water balloon, okay? This is the model of the bladder, but this is hard plastic. But basically it sits in your pelvis and the pelvic floor muscles surround it. But if the muscles are tight, they're going to be pushing on it, either giving you the sensation that you need to pee, or they're already tight, so there's no more tightness to prevent peeing. So that's something like super common I see is there's actually tightness instead of weakness. Sometimes there's weakness and we work on it, and that improves, but that alone I have not seen fix someone's bladder leakage with running. So the other thing we look at is what do you look like when you run? Is there weakness in the hips? And you can think of like a lot of patients I've seen lately. And when I ask them that, they're like, oh yeah, I always have this hip pain too. And so we got to work on the hip pain. And when we work on the hip pain, then their pelvic floor gets better. And here's what I think is happening is if you have a hip pain, that means something isn't mechanically working right in the hip. Something's tight, something's weak, something's pinching, something's not working right. And so what I think is happening is your leg and your hip are compensating in a way, and then your pelvic floor muscles are trying to do the job of your hip muscles, and your hip muscles are much bigger, thicker, stronger, more powerful muscles. Your pelvic floor is like this thin layer of muscles at the base of the pelvis. So it tries to help when the other muscles fatigue, if they're weak, if, let's say your glutes aren't working and your hip flexors are trying to do the job of the glutes, then you might feel pinching. And the hip flexors also aren't that big of muscles, and so when those get fatigued, then your pelvic floor is going to try to help out, and that's often where bladder leakage comes from. So yeah, what I've seen in all my patients, it's like, yes, we address the pelvic floor, like the weakness or the tightness, but I really think, and I'm still working with a lot of these women right now, I haven't quite seen the end of it, because a lot of them are newly coming in because now they're increasing their mileage, they're increasing their workouts. But I really think if we fix the hip, then the pelvic floor gets better. And I've seen that, right? And they can kind of tell me like, oh yeah, I have less hip pain and less bladder leakage, right? Or if I do too much and my hip gets irritated, I have more bladder leakage. So there is definitely a correlation. So maybe I'll come back in a few months and make another video. But if you have bladder leakage and you go to pelvic floor therapy, make sure they look at the rest of you too, because especially in athletes, Kegels are not enough. So again, our Kegels can only produce so much force, and running, each step is like 2 or 3 times our body weight. So our pelvic floor muscles are not lifting like 300, 400 pounds, right? Or more, right? Like let's say if you weigh only 100 pounds, which most adult women don't weigh only 100 pounds, but 200 or 300 pounds is like 2 or 3 times your body weight, right? There is absolutely no way your pelvic floor can resist that much body weight. So there has to be something else. your hip muscles, your leg muscles, they can absorb that much weight, that much force, but not the pelvic floor. So probably got to look at the legs, the hip, the back, things like that. So all this to say, Kegels are not the only answer. Sometimes Kegels are the wrong thing to do because maybe you have tightness, so you need to get that assessed. But you also need to work on the running mechanics. And the other interesting thing that I can tell you of all my patients lately that came in for bladder leakage with running, all the females, like as I started to assess them and ask them more questions, they're like, and look at their running, they're like, oh yeah, I always have this pain in this hip when I run or after I run. I'm like, interesting. And then when we assess things, it's like, oh yeah, that hip is like not working well. So it's very interesting to me that they're like, oh yeah, this hip always bothers me, but like that's not why they came in. But there's definitely a correlation. So stay tuned. Maybe I'll come back in and make another video. So if you have bladder leakage, it's not normal. It can get better. See a pelvic floor therapist. Make sure they're not just giving you Kegels and that they're looking at your running form and your strength and your flexibility of other muscles as well. All right, see you next time.